Healthcast, a breakthrough for scientists studying ways to treat Parkinson's disease, and it involves a method that has long been used to treat type 2 diabetes. Plus, researchers warning of a new bad habit that could be just as dangerous for your health as obesity and smoking. Our medical specialist, Christy Kruger, in our newsroom now with today's Healthcast. Christy.
Yeah, a couple of really interesting studies. Researchers in the UK are celebrating, but they're also urging some caution today after they called it a eureka moment of sorts concerning treatment of Parkinson's disease. Patients with Parkinson's experience brain damage and a loss of dopamine-producing cells. Now, there are treatments that can boost the dopamine levels, but scientists really haven't found a way to stop all that brain damage. Well, this study out of London shows that a medicine called exenatide, which is usually used to treat patients with type 2 diabetes, can actually slow the progression of Parkinson's disease. Patients who were not given exenatide showed much faster decay of their brain tissue, whereas those who did take the drug showed stable brain activity. But the results only worked for about a year. Now, the researchers urge that more testing is needed to develop a drug that consistently and permanently hold off Parkinson's disease. And also in today's Healthcast, researchers at Brigham Young University say that loneliness and social isolation are becoming a greater threat to public health than obesity. Researchers looked at studies involving more than 300,000 people over 30 years, and what they found was that people with strong social connections are between 26 and 50% more likely to outlive people who say they are socially isolated or lonely. One researcher wrote that such a considerable benefit is like quitting smoking and actually exceeds the benefit of cutting out other dangerous lifestyle habits, things like obesity or physical inactivity. Researchers say more than a quarter of the U.S. population lives alone. Many are elderly, and they now suggest a wide range of solutions, things like social skills training in our school systems and perhaps adding social connectiveness as an item on doctors' checkup lists. Now, with your Local 10 Healthcast today, those two interesting studies to think about. I'm Christy Kruger.